Over the past several years, more people are starting to ask a different question about cancer. Not just, how did this happen? But how did my body allow this to happen in the first place? For a long time, the focus has been on the tumor, finding it, treating it, getting rid of it. And yes, that matters, but it is not the whole picture. Your body is not just a collection of cells. It is a system where everything is connected. When you start looking at it this way, cancer does not develop in isolation. It develops in a terrain. When I say terrain, I'm talking about the internal environment of the body. This includes your immune system, your inflammatory pathways, your metabolism, your detoxification capacity, your mitochondrial function, and your nervous system. All of these systems are consistently and constantly interacting. And over time, that environment can either support health or make it easier for disease to take hold. That terrain is shaped over time, often quietly and sometimes for years before anything shows up on imaging or lab work. One of the biggest things that gets missed is that the mind and the body are not separate. Chronic stress, emotional patterns, and nervous system dysregulation directly influence immune function, inflammation, and how your body behaves at a cellular level. At the same time, treatments like chemotherapy, radiation, and surgery, while often necessary, also place a real burden on the body. They affect detoxification pathways, mitochondrial function, and the body's ability to recover if those systems are not supported. The goal is not to replace these treatments. The goal is to support your body through them so it can process what it has been through, recover more efficiently, and maintain the systems that are responsible for healing. In practice, this means supporting detoxification pathways so the body can process and recover, especially during and after chemotherapy and radiation. It means providing targeted nutritional and metabolic support so cells have what they need to function and repair. It means regulating the nervous system because chronic stress patterns directly impact immune function and inflammation. And it means supporting the body before and after surgery so recovery is more efficient and the system stays resilient. When you start looking at cancer this way, the conversation shifts. It becomes less about fighting the body and more about understanding it. Less about isolated treatments and more about restoring balance across the entire system. If this way of thinking feels different, that is intentional. I created a free guide that walks you through how this works and how to start supporting your body during and after treatment in a way that's actually practical and personalized. If you're ready to understand what your body has been trying to tell you, you can click the link below to download the guide.